Dr.
Go ahead.
Akhila. Good afternoon, everyone. I'm Dr. Akhila, consultant fertility specialist, Oasis Fertility, Gachibowli. Today, we're going to talk about IUI. IUI would mean intrauterine insemination. A few things about IUI. What is it? What is the procedure? What is the success rate? What are the advantages, disadvantages, the risks involved? How many cycles do we typically do IUI for? These are some of the things that I'm going to talk to you about. And before we get into IUI, I would like to explain what is fertility, what actually happens naturally. So, a woman has a uterus, two tubes, and two ovaries, and typically she produces one egg every cycle naturally. So, in the middle of the cycle, in during the fertile period, this egg grows to a certain level, a certain size, and once it ruptures, it is picked up by the tubes. Now, this is called as ovulation. Once it is picked up by the tubes, it is stationed in the tube itself, and at that time, when intercourse happens, the sperm travels from the vagina through the cervix, through the uterus, meets this egg in the tube. This is where fertilization happens, and once the embryo is formed, it travels through the tube into the uterus and implantation occurs. This is fertilization. This is what happens naturally. And uh, if over a period of time, over a period of 1 year, safe, unprotected intercourse is followed for 1 year, and the couple still does not conceive, then that is labeled as infertility. Now, IUI is one such treatment modality for infertility. So, IUI is typically defined as intrauterine insemination, wherein the sperm is washed or processed and it is put into the uterus at the correct time. So, IUI most often is done along with ovulation induction, which means that the woman is given some medicines for the eggs to grow. If she has regular cycles, it is expected that naturally she is able to produce a single egg, and an IUI can be performed in a natural cycle, that is without giving her medicines, and this is usually done if there are any coital difficulties and things like that. This is called as a natural IUI, but what we usually do is ovulation induction with IUI. That is, a woman is given some medicines for an egg to grow. If she's got irregular cycles, she's not producing an egg of her own. We at least aim to grow one egg, and if she already has regular cycles, then at least about 2 to 3 eggs is what we aim at. And once the eggs are grown, the sperm is processed and it's put into the uterus. This is what is IUI. What is the rationale behind doing IUI? So, when natural intercourse happens, there are certain checkpoints in the female for the sperms. That is, the first is the vagina, where the acidity of the vagina kills a few sperms. And next is the cervix, where the mucus in the cervix doesn't allow the rest of the sperms to cross the cervix and enter the uterus. So, about 0.1% of sperms, once they are deposited in the vagina, actually make it to the cervix. And about maybe 1 in 4 million motile sperms actually reach the fallopian tube where fertilization occurs. So, because of these numbers, IUI helps us in a way that once the semen is processed, it the sperm, the semen, once it's produced, is actually sperm and seminal fluid. So when it's processed, certain leukocytes, prostaglandins, and everything, oxidants, these are all removed, and the good quality sperms are concentrated and mixed with the culture media, and they're put into the uterus. So what is happening is we're bypassing the vagina and the cervix, and it's directly placed into the uterus. So the sperm is now going to travel only from the uterus to the tube. So that distance is less, and therefore the success is more. Um, what are the Let's get into what are the indications of doing IUI. So we can perform IUI, like I've already mentioned, with couples who have coital difficulties, that is, penetration issues or ejaculatory problems or erectile dysfunctions in the male. These are some of the indications of doing IUI. And in these conditions, IUI can just be performed without even giving medicines to the woman for the egg to grow. But in certain other situations, like unexplained infertility, which means that the woman is able to grow an egg, the tubes are patent, and uterus is normal, intercourse is happening, and the semen analysis is also normal, yet the couple is not able to conceive. This is called as unexplained infertility. So IUI is an option in women with unexplained infertility as well. The other condition is endometriosis, which means that the lining of the uterus is called as the endometrium, which is there in the cavity. And if this tissue is found anywhere apart from that in the cavity, that is, if it is seen in the ovaries or the tubes or anywhere else in the pelvis, on the gut or the bladder, things like that, then it is termed as endometriosis. So, in mild cases, IUI can be offered to couples with endometriosis. Also, mild male factor infertility, that is, if the counts are slightly less. The prerequisite is that at least 10 million motile sperms is what we require for IUI. Anything less than that, the success is a little less. And even the motility, if it is slightly less, so once we process the semen, like I have told you, the motility improves, and it is that concentrated sperm that we take in and put it into the uterus. So a mild male factor infertility is another indication for doing IUI. What are the advantages of doing IUI? So it is a very simple process. It's an OPD process, that is, there's no anesthesia required, and it is just like any other any other scan that we would do routinely. And IUI is done under ultrasound guidance, but we can do it even otherwise. But it is just a speculum examination, and a catheter is used for the semen to be introduced into the uterus. So basically it is simple, and it is safe. It is safe because we process the semen. If the semen is not processed and if it is injected into the uterus, because of prostaglandins and other components which are there, a woman can have few reactions. She could have nausea, vomiting, pain, things like that. So the semen is processed. A processed semen, if it is put into the uterus, it is very safe. So it is simple, it is safe, and I told you it's an OPD procedure, so which means it is non-invasive. No anesthesia is required, and relatively it is inexpensive. So the cost also is not huge, and approximately it might cost about 7 to 10,000. It is not very expensive at all. And the procedure, so I'll let you know what the procedure is. So all treatments in fertility typically start with the start of the period. So on first, second, or the third days is usually when we start these procedures. So for IUI, we usually call the woman on the second day, and we do the scan. And if there are no follicles or eggs already growing, we start with a few medicines for the eggs to grow, and we schedule the scans thereafter, once on the fifth day. And depending upon how the egg is growing, the rest of the scans are scheduled. And once the follicle is of a particular size, usually what we aim is more than 18, 18, more than 18, about 19, 20. And that's when we give a trigger injection. That is typically HCG injection is given, and we schedule the IUI about one day after. We expect ovulation to happen anytime between 24 to 36 hours after giving the injection. So once the injection is given, we call the woman the next day also to do the scan. If she ovulates, IUI is done the next day. But typically what we expect is the day after that, that we do the IUI. And this procedure hardly has any disadvantages, but if anything is to be there, it is just that you need to come for scans about 3 or 4 times, and that is what it is. Otherwise, there are no particular disadvantages at all, and there is no requirement to take any leave from work. Uh, After the procedure, the woman can get back to doing her office work or routine house job as she usually performs. Um, and the timing is something that I have already told you. Once the IUI is done, after 2 weeks, we tell the couple to take a pregnancy test, and that's when the entire cycle is over. So the success of IUI is about 10 to 15%. And should a couple not conceive in the first cycle itself, we tell them to go through another IUI, and typically we do about 3 to 4 cycles of IUI, and consecutively when it's done, there's a cumulative success rate. So this is what we look at least 3 to 4 cycles of IUI if the first one happens to fail. What are some of the prerequisites for IUI? So, for IUI to be successful, we need the egg to be growing, we need the sperm to be processed, and the endometrium of the uterus should be ready. Endometrium is something more than 8 is what we aim to have. And importantly, the fallopian tubes should be open, at least one tube should be patent. So to check for the tubes, we routinely perform something called as a hysterosalpingography, where the tubes are where a dye is introduced into the uterus. It's a radiological procedure. An X-ray is taken, which tells us whether the tubes are open or not. So this is an important prerequisite before we can perform the IUI. And there's something called as a double IUI, which is it has a marginal success rate compared to an IUI, about maybe 1 or 2% extra success compared to IUI. So what is usually done is once the trigger injection is given, an IUI is scheduled the next day, and after ovulation, the next IUI is performed. This is something that we can do for couples who have not succeeded with 1 or 2 cycles of IUI. What extra we can do is a double IUI. And how to improve the success of IUI? Importantly, once the IUI is done, to get the woman to rest at least for 15 minutes increases the success rate of IUI. Also, regular exercise, good diet, avoiding junk food. These are some of the things that play a vital role, not just with the fertility, but even avoids other hazardous health conditions as well. And a lot of women ask if IUI is painful. So it is not painful at all. It is just like, as I said, most often a scan is usually performed and IUI is performed under ultrasound guidance. So, as much pain as you would have if a speculum examination is done or if a scan is done, it is just as much. So, I would say it is not painful at all. And what restrictions should a woman follow after the IUI? So typically there are no restrictions with food, no restrictions with travel, no restrictions with climbing stairs, or no restrictions with intercourse. And we actually tell the couple to have intercourse that day and the next day as well, for 2 days after the IUI. And and she can perform all her routine activities as she's been doing, and there is no need to take a break from work as well. So as such, there are no restrictions. And another important question that most women have is that how safe is IUI, and what are the risks and complications of IUI? If and how is it different from a natural pregnancy? So IUI, if a woman conceives through this process of IUI, or if she gets pregnant naturally, the complication rate is more or less the same. So there are no extra risks or extra complications with IUI, and there are no side effects of IUI in the babies. There are no congenital problems because of IUI. None of these. It is as good as getting pregnant naturally. It is just that we process the sperm and it's placed into the uterus using a sterile catheter. And these are some of the things about IUI. And if anybody has any other questions, please. No questions? How does IUI affect the sperm? So the sperm actually is improvised. Like I've been telling you, we wash the sperm. What is more than washing, we process the sperm. That's a better terminology, rather, which means that the sperms are centrifuged, and the good sperms are collected and they're put into a concentrated pellet and mixed with the culture media. So what happens is, once we put this in the uterus, there are no reactions to the woman, first thing. And second thing is, it bypasses the cervix and the vagina and it's directly put into the uterus. So the distance, the travel distance is less for the sperm. We're bypassing the cervix and the vagina. And the third important thing is that since it's a concentrated amount, the better sperms are used, so the success rates are better. Next question, please. How is IUI performed? So, on the day of the IUI, a woman, the procedure I have almost told you what happens through the cycle and the timelines I have told you. So, the IUI is performed usually under the ultrasound guidance. On the day of the IUI, we do a scan first to check whether the egg has ovulated. And once the ovulation is confirmed, and prior to this we already know that the tubes are patent through the HSG, and after that we tell the woman to fill her bladder, because once we're performing the IUI, it's usually an abdominal ultrasound that we do and not a vaginal ultrasound. So the bladder, once the bladder is full, and in the meanwhile the husband's sample is ready, a catheter is used, a simple sterile catheter is used, and the semen is taken in the catheter. A speculum examination is done, and this catheter, which is filled with the husband's processed semen, is introduced into the uterus, and it is seen in the ultrasound that it's placed in the correct position. This is how an IUI is performed. And a pregnancy test is taken 2 weeks after. Some medicines we do give after the IUI in the form of progesterone support. Next question. Which embryo quality is the best? So we don't really talk about the embryo quality here in IUI, because we know that the egg is there in the body. We know that we have introduced the sperm, and the egg and the sperm, whether they have met or not, is something that we don't know in IUI. This process of fertilization that I have explained usually happens in the fallopian tube. And once, if the quality of the egg and the quality of the sperm is good enough, so it usually indicates that the embryo quality is good, which once formed goes back to the uterus and implants there. Next question, please. Okay, so how long after ovulation IUI is performed? So we give the trigger injection. Once the trigger injection is given, we do the scan the next day, that is after 24 hours, and the day after that. Typically, the IUI is performed the day after that, and we expect ovulation after 24 to 36 hours after the trigger injection. So, once the ovulation is confirmed, the egg usually um, sustains for about 24 hours. So, soon after ovulation, or within 24 hours, that is when an IUI is usually performed. So, the timing of IUI is quite important, and this we usually time it with the trigger injection. So, we have a patient's AMH level is zero point 0.3. How can I take? It depends upon the number of eggs we can see. So a scan should typically be performed. If your AMH level is 3, the number of eggs possibly is a little less. So it depends on the scan findings actually. But all I can say is if your AMH is zero point 0.3, you need to expedite your process towards fertility. And IVF is usually an option more than IUI. Any other questions, please? Okay. Thank you so much. I'm Dr. Akhila from Oasis Fertility, Hyderabad.